We begin in Midland. How likely is an Ebola outbreak in the state of Michigan? It's a top concern for many, including health officials. NBC 25's Ilse Lujan-Hayes joins us live in Midland from a hospital, speaking out this morning about what they're...
Good morning, Joel. That's right. We are right outside the MidMichigan Medical Center, Midland on Wellness Drive. And I have to be honest with you, yesterday when I placed calls to many area hospitals, this hospital was one of the few that agreed to talk about what their protocol is in combating Ebola. Now, joining us right now is Anne Eash. She actually is an infection prevention manager. Good morning. Thank you so much for being here. Now, I have to commend you. A lot of folks out there, they want to know what hospitals are doing. What can you share?
Well, as many people remember, over the past years, we've had different outbreaks and different scenarios that we've had to prepare for. So in the past years, based on those, like the pandemic preparedness, we've had an emerging disease policy. So we're building on that policy and making it specific to efforts for Ebola and concentrating our efforts there. That will include training for personnel on personal protective equipment, making sure that we have enough equipment available.
So you have done something new with your personnel confronting Ebola?
Yes, we have. Yes, we have plans in place. One of the new things we're going to develop too is the buddy system. So everyone who goes into isolation will have to have a buddy with them to check them out, and when they come out of isolation, make sure that they're not contaminating themselves.
Now, this buddy system is new. Now, Betty, I want you to take a listen to what Mark Valak, with the Genesee County Health Department, says. He says that a yearly drill with hospitals ensures medical professionals know protocol, but it's up to hospitals to enforce it. Take a listen.
The governor and the Department of Community Health, they need to take more of a leadership role in regards to mandating what hospitals must do.
Now, Betty, would you say that that's true? Hospitals have to take initiative. I understand that you are working with the CDC, but is it up to hospitals to make sure they're ready?
Yes, it's up to hospitals. And recently we had a drill in coordination with county efforts up at our other affiliates in Clare and Gladwin, and it's something that we do here in Midland too. Annually we do a drill. Yes.
Very quickly, how likely is an outbreak here in Michigan?
I think the likeliness of an outbreak is very low. It's very low risk, but certainly preparedness efforts are a major part of what we do.
All right, Betty Ann, we appreciate you taking the time this morning. Now, coming up a little later, we're going to talk about what you should do if you suspect you have symptoms related to Ebola. For now, we're live in Midland. Ilse Lujan-Hayes, NBC 25.
Well, all morning long, we've been taking you inside a MidMichigan hospital to show you how it is preparing for this and showing you their protocol in confronting Ebola. NBC 25's Ilse Lujan-Hayes joins us live from Midland with the story. Good morning, Ilse.
Good morning, everyone. Once again, live outside the MidMichigan Medical Center, Midland, one of the few hospitals that was kind enough to speak with us and show us what exactly they're doing. Now, joining us once again is Anne Eash. She is an infection prevention manager here. Good morning. Thank you so much. Now, we promised people we would tell them what should they do if they suspect they have symptoms related to Ebola?
Yeah, and in speaking with this, we're assuming that maybe they're in their home and they want to know what to do. I think the first thing they should do is call their physician and let them know what they're thinking, and phone call is the best way, so you're not going out into the community, especially if you have symptoms. And if your local provider cannot get with you and give you the correct answers, then you need to call the hospital emergency room and say, I suspect that something's going on, I need to be seen, what precautions should I take?
So phone call first, you suggest, rather than coming into the ER. Very quickly, what is the last thing you want viewers to know about hospitals like yourself preparing and confronting Ebola?
I think the risk of Ebola at this point, from what we know, is very low, but that we are doing preparedness efforts, and getting with our county health departments and looking at the CDC recommendations constantly. Anne,
thank you so much. We appreciate you taking the time. And of course, you can go to our website, mynbcnews.com, for the very latest on Ebola. For now, we're live in Midland. Ilse Lujan-Hayes, NBC 25.